what's highlighted is obviously important, but what's in green is also important. First important thing is to know what the treatment is for most things. And when you look at this, you'll end up seeing therapy, 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 therapy. Therapy, therapy, even for Tourette's, therapy first line. Except for ADHD. We'll start with ADHD. The big thing they're going to test you on is 2 or more settings. Now, they'll always almost give you a child who at school the teacher's complaining, he just talks out of turn, he just disrupts all the other students, he shouts out, answers when he's not supposed to, he's not paying attention. But there has to be something else. And typically if it's a student, they'll also tell you that at home he's also disruptive, messes up the sister's stuff, just blah blah blah, can't pay attention. Sometimes they do give this for adults, and they'll talk about workplace and stuff like you can't concentrate either. But it's almost always children. The big thing though is has to be in 2 or more settings, because if not, it might be a school-related thing, it might be something else. Always 2 or more settings. If not, on the test it's not going to be ADHD. Stimulants are first line here, compared to everything else, where it's therapy. Autism spectrum disorder. They'll almost always give you an example of a 3-year-old boy, because it's more common in boys, and the preschool teacher is telling the mom, hey, he always, is by himself. He's not communicating with others. He always wants to play with his train, and when he's playing with his train, he always just does the same thing, moves it back and forth, and does this forever. You take it away, he's not able to properly communicate, hey, I need my train back. He just throws a fit, yells, cries, that kind of stuff. They also love to test you on avoidance of eye contact. Now, don't get that confused sometimes with avoidance of eye contact from the child who's getting beaten. But that'll be a different stem, right? They're not going to tell you, oh, 3-year-old boy, everything's great, blah, 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 eye contact, and have the answer be, oh, he's getting his butt kicked at home. All right, if he's avoiding eye contact and you're checking all the boxes of he always does the same thing, needs to have everything the same way, won't talk to others, won't interact with others, doesn't do a bunch of talking, has to have things his way, is autism. Okay. Conduct disorder versus oppositional defiant disorder and disruptive mood dysregulation disorder. Well, oppositional defiant disorder is usually against people who have some sort of authority. Think of parents, think of teachers, think of tutors. Maybe if you're getting private lessons for violin or something. You just don't get along with these people, you yell, you throw things, call everyone names, do bad stuff. But it's only for authority figures. With your peers, with your friends, with people your age, you're pretty much fine. You're fine. Okay. Conduct disorder is totally different. You're bad all the time. In fact, you're so bad that once you turn 18, you're called a sociopath. Antisocial personality disorder. This is the kind of person, this is an 11-year-old kid or something who just goes around burning other people's notebooks, killing animals, stealing from the parents, stealing from friends, hitting the teacher. And this isn't like ADHD or it's in 2 places or something, but everything else is fine. No. This is always bad all the time. It's not oppositional defiant disorder either, where it's only against authority figures. You're doing this against your peers. You're doing this with your classmates. You're doing this with people in your Boy Scout group. You're doing this all the time. And again, conduct disorders as a child. Once you're an adult, antisocial personality disorder. They will test you on that, because they will give you the option. Whoa, here's this person killing animals. Here's this person setting fire to cars and stuff, stealing lunch money, doing stuff like that, and then they'll say, oh, at 12 years old, and you'll say, what a sociopath. Nope. Conduct disorder. They're not an adult. Disrupted mood dysregulation disorder is just for people who are generally kind of cranky, and then when things don't go their way, maybe they've been slighted, maybe they're not getting their sweets or something, boom, tantrum. Okay. Now we're going to go to intellectual disability versus a specific disorder. Specific learning disorder is just that, a specific subject. Addie's not doing too hot in math, okay? But she's reading at grade level, and everything else is just fine, okay? Intellectual disability, they're going to give you a 5-year-old, or they'll give you a 7-year-old. They'll give you a young child who's not meeting their milestones. This child isn't speaking the same as his siblings were at that age. This child isn't able to interact with his or her peers. This child isn't able to understand things, isn't able to, make these complex patterns in their head. This child isn't able to interact with their environment the same way that other kids are. Sometimes the kid usually actually realizes that something's going on, and so they kind of isolate themselves, and you'll notice that they also have problems with socializing and just working in that sense. It's not just something where, this one person's bad at math. No, this child has trouble with math, has trouble understanding why you do and don't do things. This child can't make, the normal connections you or I can. Selective mutism. It's literally just an anxiety disorder. And it happens in young kids. There's nothing wrong with them for whatever besides, having selective mutism. But it's not some sort of intellectual disorder. Separation anxiety disorder, they love to test you on this. They love it so much, they just might put it on your STEP exam. That, I can't say if it happened to me, but I'm just saying, just may happen to you. They love giving you this example. And then Tourette Syndrome. They always test the association with OCD and ADHD. Also, differently from OCD though, you give antipsychotics for Tourette if you don't have normal therapy doing anything. Okay. Orientation. Which goes first? Time, place, person. Think about it. If you're going to forget something first, it's not going to be who you are, and it's not going to be where you are. It's going to be the time. In fact, you probably don't know the time most of the time. And they'll always test you on hypoglycemia more than anything else. Obviously, everyone knows that if you're drunk or blitzed out of your mind, all right, you're going to be disoriented. Everyone knows that someone who just suffered a severe blow to the head is going to be a bit disoriented. If you're septic, you're going to be disoriented. Okay, got it. But they love testing your hypoglycemia because it's quick to test and it's something everyone misses. They love it so much. So remember, conduct disorder. You can't be an adult because then it's antisocial personality disorder. You want to think of a sociopath as a child. Oppositional defiant disorder, you're just a pain in the butt against authority figures. And ADHD, 2 or more settings. You can also see it in adults, which is why they include things like, it's in the workplace and it's at home. But for a child, it'll always be at home, it'll always be at school. You have to have 2 or more things. And remember, first line for most of the things are therapy, except for ADHD, where you got stimulants.